Contraceptives were very, very popular and common during the one-child policy era because officials needed a way for local guarantees that they will never have a baby after their firstborn was given birth, and therefore contraceptive methods were very, very prevalent during the period. However, the glaring disparity in medical leave policies for contraceptive procedures, 3 days for women receiving IUDs versus 7 days for men undergoing vasectomies, is very, very prevalent. The shorter leave policies for IUDs reinforced the perception that female reproductive health was less valued than male health. The disparity was not merely bureaucratic neglect, but a deliberate feature of a system that treated women's bodies as instruments of state control. Even today, as China promotes higher fertility, these gendered inequalities remain embedded in medical and labor policies, such as shorter maternal leaves. Given that IUD insertion is often even more physically taxing than vasectomies, requiring cervical dilation, carrying risks of cramping, bleeding, and infection, the current 3-day allowance is woefully inadequate. A fair policy would mandate at least 7 days of paid medical leave for IUD insertion or removal, matching the vasectomy standard. Extend leave for complications such as prolonged pain or infection without requiring additional bureaucratic hurdles, and include coverage for follow-up visits, ensuring that women can seek medical attention without penalty. The legacy of coercive IUD use under the one-child policy has left many women with negative associations with the procedure, and to rebuild trust in the autonomy, we need to require comprehensive counseling about all contraceptive options before IUD insertion, ensuring that women can make informed decisions on whether they want oral contraceptives, implants, or barrier methods. We should also prohibit quotas or incentives for healthcare providers to promote a specific kind of method, preventing de facto coercion. Publicize alternatives for IUDs in family planning campaigns is also important because this means that China is now emphasizing no single method should be the default. Beyond contraceptive leaves, broader reforms are needed to protect women's health in the workplace. For example, mandate paid leave for menstrual health conditions such as the severe cramp, a policy that's already piloted in some provinces, admittedly. We should also prohibit discrimination against employees who take reproductive healthcare leave, with penalties for employers who retaliate. And finally, subsidize employer costs for such leave to reduce resistance from businesses. The IUD leave disparity is symptomatic of a larger pattern of neglecting women's health. Policies should audit gender gaps in medical research funding, ensuring conditions like endometriosis, which affects 10% of women population but remains under studies, receive proportionate resources. Train healthcare providers to recognize and reduce gender bias, such as dismissing women's menstruation pains as normal. And finally, include male contraception in public health programs, distributing responsibility more equitably. The 3-child policy's success depends on women's willingness to bear children, which in turn requires trust that their health and dignity will be prioritized. Fair leave policies are not just about days off, they're a statement that women's well-being matter.